Protesters in Huntington Beach out in full force on the first night that a statewide curfew went into effect. Welcome to Inside the Issues. I'm Alex Cohen. Last week, Governor Gavin Newsom ordered this curfew in response to a swiftly rising spike in coronavirus cases and hospitalizations. And yet, plenty of Southern Californians are not heeding that call. For more on how that is resonating with the medical community and how physicians are faring 8 months into this pandemic, we turn to one of our favorite physicians here at Spectrum News 1, Dr. Jerry Abraham. Dr. Jerry, it's great to have you back with us.
Thank you for having me, Alex.
I'd like to begin with, because I feel like we know we're seeing a spike in a number of cases, a spike in a number of hospitalizations, but there are still plenty of people out there who have no personal direct experience with coronavirus, so really may not have a sense of what is happening at clinics and emergency rooms and hospitals throughout this vicinity. Can you tell us what you are seeing and what you are hearing right about now?
It's like we're living in multiple Los Angeles. Some people are clearly, as you mentioned, not coming into contact with the reality that we're well within the beginning of a very serious third spike, I would say. And we're seeing that flooding our emergency rooms, our clinics. A lot of our essential workers are affected by this. Here in our own clinic and our hospital, we daily have patients and staff that are contracting COVID, and it's clearly creating a lot of staffing challenges. And of course, there are actually patients who are suffering and dying from COVID. So it is challenging to have to try to educate the public that this is real. It is here, even if you don't see it in your own home or in your own community or daily life.
So, Dr. Jerry, I think in a lot of ways it feels like what we were seeing back in March, right? That initial concern, are there going to be enough hospital beds? Are there going to be enough ventilators? But it seems like, at least from what I'm hearing and gathering, that things are somewhat different. For example, we might have enough ventilators now, but not enough people to operate them. What are some of the key differences between then and now that we know a bit more about the pandemic and have had a bit more time to prepare for it?
And I think that's exactly what it is. We've had a little more experience and time with SARS-CoV-2, what we called COVID-19. Back in the earliest days, we were still wondering about the infectivity rates. We were worried about the mortality rates. We weren't quite sure how best to manage critically ill patients with COVID-19, whether it's caring for them in the ICU on ventilators, whether we pronate them and turn them onto their belly or not. What treatments might we offer, whether it was remdesivir or the national conversation we were having around hydroxychloroquine. So over time, over the last 6 to 9 months, we've gained information and a better understanding of how to manage and prevent COVID. And so that's been very helpful overall.
And yet people are still dying. And from what I'm understanding, I get those LA County Public Health Department emails every day. And the first thing I do when I get it is I take a look at the number of cases and deaths. And for a while, the number of deaths, we actually got them back down to the single digits, something that we hadn't seen for a long time. But they're starting to creep back up into the double digits. And I know that there are concerns based on the fact that we're seeing more and more positive cases and we're heading into the Thanksgiving holiday. I know no one can see perfectly into the future, but what are you expecting to see as we face this last couple of weeks and months of 2020?
Of course, we're afraid that people are restless, and this has been terribly isolating, and it affects the human mind and the way we interact with others. And so people may be drawn to want to go to a Friendsgiving or Thanksgiving this year, spend time with loved ones. And I just really remind them that, we all have grandparents or loved ones with pre-existing conditions that may make them more vulnerable. So just to be extra cautious of that as we go into the holiday. But that's really why I think we do fear that the numbers may rise 2 to 3 weeks, specifically in hospitalizations, critical care patients, and mortality after Thanksgiving because of some of the choices that we make. And we do have a lot of control over that, even though it's a really tough time. Holidays are very important for families and for loved ones and memories, and this year is a little different.
And I think that expected rise was probably in large part what informed a decision that came out on Sunday that restaurants will no longer be allowed to offer outdoor dining starting on Wednesday night. And this happening right before the Thanksgiving holidays with so many eateries investing so heavily in being able to offer outdoor dining. Some have seen as a really rather shocking blow. But talk to me about what's on the other side. I know that you are not part of the Department of Public Health. You're not the ones making this decision. But can you tell us a little bit about what we have learned about eating and drinking and how that can contribute to the spread of this virus?
What I would say is that we have, as we, over these months, learned how it's aerosolized when we're speaking, when we're singing, when we're shouting, and even when we're eating and drinking. There is spray, and in that spray carries COVID-19 virus. And really, some of it also depends on quantity of virus, dosing of the virus. And so that's why you're seeing in some of those early examples, people in choirs or people at rallies where there may have been a lot of spray is where you may have seen a lot more infectivity. So those are things that I think early on, we had talked on this show and on others about fomites, things that you touch, so is the virus on the door handle or on the groceries I bring home or the to-go boxes. But also we're learning more and more that it's kind of what is actually being sprayed out of our noses when we touch or out of our mouths when we touch our noses. All of that kind of contributes to people's exposures. And based on that is whether or not you get, and there are other factors we're learning, whether there's still some research coming out around blood type and who else is more susceptible based on certain types of receptors in your body.
Yeah, and of course, as these nights become chillier here in Southern California, I don't know if you've seen this, Doctor, but I've certainly seen a lot in my neighborhood of restaurants that are doing the outdoors eating, but now putting tents with heat. So it's kind of like you're inside even if you're outside. But I think everybody, as you mentioned, is at this point where they're just feeling so frustrated and fed up. So I'm curious, when you see things like people protesting without masks in large groups of people out in Huntington Beach, or you're just even out and about in your personal life and you see people walking around without a mask, but you are also seeing the real impact that this virus can have. How does that feel to you? How does that resonate with you?
That is interesting. Those new environments outside, this outdoor seating, we're sitting in tents. So I think ventilation does play a role. And so there's lots of things like this that we probably can't control. But I think the hard part when it comes to things like rallies and these larger public gatherings, I've been wondering about, our professional sports leagues. And I know there's this real balancing act. There's a lot of value added by us coming together to support or root for our team or to hear a performance in person, to go to church together. But I mean, even from that day that Biden and Harris were announced the victors of this election, a lot of people were on the streets. And of course, my gut reaction was, I really hope people don't get sick from this exposure. And I know that is happening. And we did see that happen throughout the election season and even since. So to your point, I mean, people are very upset and distraught. And there's this question about, is this an infringement on your freedoms and liberties? And sometimes we have to make decisions that support kind of the collective and population health. And in this case, we're really having to have these two competing values of, yes, you may feel that your rights or freedoms are being infringed upon, but it actually provides us a lot of liberty and health by doing it, by making sure that our communities are safe and healthy. So, of course, the knee jerk is to be like, oh my gosh, what are people doing and why are they out there and why are they not wearing masks? But I totally understand why people are going stir crazy. Just keep that in mind. It's not trying to take away anything from you as an individual. It really is about protecting, imagine, your grandma, your grandpa, your loved ones that have illnesses and making sure they're here for the next holiday season.
I heard a really interesting notion the other day from an expert at Johns Hopkins University who said part of the problem is just in terms of how we wrap our brains around it, and that when you hear about, coming up on 250,000 people who have died in this country, that's just a number that's just too big for us to process. And in some ways, we're able to feel more, connect more when, let's say, it's a fire or a plane crash or something, and it's maybe only 20 people who have died, but we can wrap our brains around that a bit better. And I think along those lines, because so many of us don't see what is happening in clinics and hospitals, it's a lot easier to just feel the pain and frustration of the things that we can't do instead of thinking big picture. So with that in mind, could you maybe share with us a patient that you've worked with, a doctor that you've heard from that you feel like, man, I just wish that the public could see this part of it or understand this part of it? Or, I think back to the beginning of the pandemic and all the stories of people whose loved ones had to die utterly alone because of the contagion factor. What is it that you wish people could know that you know that might change their minds about the decisions they make?
I'll just start by saying, earlier I had mentioned we live in multiple Los Angeles, and I work here in South LA, and I see, in communities where people are essential workers and they're living in housing that's very dense, and everybody in the household is catching it. So while many of us may have the luxury to live in our urban dwellings or condos or single family homes, there are many who don't have that luxury. And so their reality is that when someone does get it, it kind of does spread to the whole home, maybe to your neighboring apartments, maybe to your whole complex. And that's why we're seeing these numbers driving up, especially in places like Compton and South Los Angeles. As far as what I wish people could see or hear, of course, it is absolutely devastating for all of our nurses and doctors that have to care for patients in ICUs. And this time around, we don't have family and loved ones to be there with us to really be supports for that patient. And in many ways, it's such a valuable part of the care we provide patients is to be able to be there with family and loved ones of this individual that is struggling to survive or maybe even dying. And we're not used to not having loved ones around when a patient's dying. And that's hard not only for the family, but it's hard for us because it really helps put into perspective the work that we do and that this is a human being, this is somebody's loved one. And so I know I've got intensivist friends, critical care nurses that are having to help families say goodbye without the families being able to touch, to hold, to talk to sing with, to pray with in those final moments. And that is creating, I think, a lot of anxiety, mental health burden, even within the healthcare workforce, because are we doing enough to make you feel that you're being treated with dignity and respect there in the end?
Dr. Jerry, thank you so much.
Thank you, Alex.